An important aim of addiction treatment is to improve the health of the client and to improve their lifestyle. The most well-known form of substitution treatment is nicotine replacement therapy, but opioid substitution is another important one. Additionally, from a public health perspective, harm reduction is a valued tool to manage, for example, the spread of blood-borne viruses like hepatitis C and HIV. This approach accepts that a person is not capable of abstaining from drug use at this moment and offers options to reduce the risk of illegal drug use. So what are the goals of harm reduction? Important goals are to reduce the risk of illegal drug use, reducing the risk of the method of drug use, for example, smoking or injecting. When using substitution treatment, the client can gradually work towards abstinence by dealing with psychological aspects of their addiction and gradually reducing the dose of the medication. However, some patients will make multiple attempts at abstinence and fail for various reasons. For them, long-term substitution treatment may have the most positive impact on their life. It can support them to focus on getting their life back on track and reduce the risk of harm to themselves and others. Substitution treatment may not seem intuitive for some, but has been proven to be very effective in reducing drug use and in improving general health, especially in opioid users. There is a very strong evidence supporting the effectiveness of opioid substitution treatment in terms of decreasing mortality, improved health and quality of life, and reduction in risk behaviors and criminal activity. The strength of the evidence has resulted in the two most common medications used for opioid substitution treatment, methadone and buprenorphine, both being included in the World Health Organization list of essential medicines. Nicotine replacement therapy is also included in the list. Substitution treatment is only available at this time for opioid and nicotine users, but research is taking place to test the effectiveness of substitution treatments for amphetamine and cannabis users. There are very few medications available to help people manage these addictions. Like opioid drugs, amphetamines are often used by injection with the associated risk of blood-borne viruses. Opioid substitution treatment has been an important element in controlling the spread of HIV or AIDS. Substitution treatment for dependent amphetamines users could potentially have considerable public health benefits. To summarize, medications can be used to reduce craving, modify drug effects, or reduce the risk of drug use. Extensive research is taking place to develop new treatments to help people manage their addiction, as there is a large group of users for which we do not have effective medications. We look at future directions in week 5, including how we might use medications more effectively in combination with psychosocial support.